big myth that you always need to take out your wisdom teeth. And in this video, I'm going to talk about exact situations where you actually don't need to take out your wisdom teeth at all. So let's get started. So what are wisdom teeth? The third molars in our mouth, which is the last teeth. Usually the wisdom teeth erupt from the age of 17 to 25. However, they can actually erupt much later. So the big problem that humans face with wisdom teeth is not actually having the teeth itself. It's actually that a lot of people's jaws are too small to accommodate the third molar, which is the wisdom teeth. And some of the problems that can arise are infection, cyst formation, crowding of the teeth, and damage to adjacent teeth. Infection is actually the most common type of wisdom teeth problem that we have. Scientifically, this term is called pericoronitis, which basically means inflammation of the gums. What happens is a lot of times the gums get irritated and they can get infected. So one test to see if you have pericoronitis is to actually touch the back of your teeth or floss with the back and see if it's bleeding. Another thing you can do is actually see if the wisdom teeth is actually poking in a little bit. So you can kind of see half of it, but not all of it. Sometimes that's when it's erupting, but that's a good sign that it's actually stuck and it can't fully come all the way up. One of the worst symptoms we can get from wisdom teeth eruption is cyst. A cyst is actually a fluid-filled balloon in a way. And as this keeps expanding and this balloon keeps getting bigger, the bone gets destroyed. And this can actually have some serious consequences. So let's watch this video. Can you see that balloon-like sac? So that used to be a tiny little cyst and it just kept getting bigger and bigger. And it got to a point where it's destroyed massive amounts of the bone. It's probably destroyed the teeth adjacent to it. And it's getting close to the nerve and causing a lot of serious issues. In this situation, what the oral surgeon does is they actually remove the cyst and they pack bone inside there. We basically want to do this as soon as possible before more jaw gets destroyed. The third thing that can happen is actually damage to the adjacent teeth. This is actually very common, and part of the problem here is the direction that the wisdom teeth is going into. So if there's not enough space, we have the wisdom teeth erupting and it's moving in the wrong direction towards the next tooth. As we can see in this picture, it's gonna start destroying and resorbing the tooth next to it, right? And as that tooth gets more and more destroyed, it's kind of like the cavity that you can't fill. The tooth will start hurting and you actually have to take out that tooth. One big wisdom tooth myth that I hear all the time is, will my wisdom teeth cause my front teeth to move? And that's because a lot of people are conscious of their front teeth. They usually blame the wisdom teeth causing the front teeth to move. But that's actually a big myth, right? And you can like logically think about it, right? If the wisdom tooth was to push the teeth in front of it, right, causing the front teeth to move, then all the teeth would be crowded, not just the front. So that's actually a big myth. So how long does the wisdom teeth surgery last? It can last about 45 minutes to an hour, sometimes even 15 minutes if they're actually erupted and easy to take out. A lot of patients ask me, do I need to be put under for wisdom tooth removal? Actually, like 90% of the time, you don't need to be put fully under. Just local anesthetics works. When you locally anesthetize your mouth, right, you get it numb, you actually don't feel anything. What you're feeling is just a little bit of pressure, the wiggling of the tooth essentially. All right, so what is the aftercare after you successfully remove your wisdom teeth? Do I need a ride home from my parents or my loved ones? Unless you're actually being put under, typically you can actually just go home yourself, but it's always a good idea to have someone help you out because you're in a vulnerable state. What you should expect is a little bit of bleeding after the wisdom teeth removal. What we want to do is press the gauze really firmly in that area that the wisdom teeth were removed, right? The more pressure and the longer we keep that pressure, the faster the blood will clot and the faster the bleeding will stop. You can use ice to reduce the swelling and inflammation. Ibuprofen is a good idea. Tylenol is a great idea as well. Avoid hard foods for at least 3 days. You want to give the area as limited irritation as possible, right? Which means don't brush over that area, avoid hard foods, have a soft diet for three days or so. Avoid using straws. All the suction from the straw that you might be using is gonna kind of pull the blood clot and prevent the clotting to happen. And one big thing is do not smoke. Smoking after any type of extraction is one of the most dangerous things you can do. The longer the better, obviously, but at least a couple days after. This is because the toxins in the cigarette can actually cause dry socket. The nerves of the area are actually exposed and the blood clot doesn't form over them, right? So you have like these free nerve endings. They become super sensitive, and that's one of the worst symptoms you can have after any type of extraction. Good nutrition plays an important role in any kind of recovery. Some examples of foods that are soft and maybe a good idea would be smoothies, scrambled eggs, mashed potatoes, soft fish, and other kinds of soft meats. How long is the recovery? So typically 14 days is a good ballpark to expect in terms of total recovery time. The first few days might be a little bit painful, but as the time goes on, that pain gets significantly reduced over a period of time. And by the 14th day, you should be back into good shape. So I promised you guys I was gonna tell you situations when you actually don't need to take out your wisdom teeth. And here we have a great x-ray. So I can kind of show you guys what I mean, right? So the first situation you actually don't need to take out your wisdom teeth is if it's fully erupted, right? And it's not symptomatic. It doesn't hurt you, it's not bothering you. And this is not 100% of cases, but generally most of the time, if this fully erupted and it doesn't hurt you, you can probably pass by. You can see a lot of adults in their 50s and 60s who still have their wisdom teeth in this condition that's been really good. So in the lower right, we have a situation where it's partially erupted. That wisdom teeth isn't fully erupted. And the reason why we can say I can kind of see that because there's bone on top of the wisdom tooth. On the bottom left, we see a wisdom teeth that's kind of like sleeping. And in that situation, that wisdom teeth is actually pushing against the other tooth, and we can see this little, like the hole, the circle adjacent to it, that's caused a huge cavity. So on the right side, what we can actually see is a wisdom tooth that's fully erupted. So that's a situation where we can actually just leave that one in. Now on the top left, if we go back to the left side, the tooth looks like it's fully erupted, but there's a huge cavity in there. And that might be a case where if the dentist can't fill that cavity, we might be better off just taking it out. So these are some really good situations. These are majority of the situations where we actually have to take out the teeth. And I show you on an x-ray where you might be able to pass on one of them, right? This is a common question I get asked, okay? The patient comes in, right, and they say, oh, one of my tooth hurts so much. Please, can you take it out for me, right? And the dentist says, it's better to take all of them out. So if you take out one of your wisdom tooth, let's just say the lower right one, what actually tends to happen is the upper right one may actually fully erupt and come down, right? And as this tooth comes down, it's gonna cause bite problems. It's gonna cause biting issues. So we do recommend actually taking the opposing teeth out with it, because if there's nothing occluding, hitting it or occluding it, might be a good idea to take the opposing one out too. My wisdom tooth was hurting last week, but now it's all good. Pain is actually the last straw. So when we have pain, that means that it's too late. That means there's something wrong, right? So majority of the time, if you start to have some pain, it's a better idea to tackle that issue, take care of it, because it's only gonna get worse. And majority of the time it's gonna come back. It was hurting for a reason in the first place, right? It's not out of the blue. Do I need to take out my wisdom teeth before braces? Majority of time, the orthodontist or the dentist doing Invisalign or braces may suggest you take out the wisdom teeth before doing braces. You don't always need to take out your wisdom teeth. You might want to get a few opinions to finally make your decision. But a lot of times teeth can be moved without needing to take out the wisdom teeth. But it might be a really good idea to just get it over with, take them out, because there isn't really that many advantages to having the wisdom teeth in play. I have a cavity on my wisdom tooth. Do I need to pull it or should I fill the cavity? Depending on the skill set of the dentist, they might choose the latter. And part of the problem with having a cavity on the wisdom tooth, our instruments actually can't really doesn't really fit in there. So that means the restoration that we're putting on the wisdom tooth may not be the best restoration, it might not last the longest because it's really hard to put in. So basically, either option could be a good option.